Awesome. Well, good evening, everybody, and welcome to another edition of Ask the Doctor. We are super blessed to have Dr. Bob Rakowski with us here this evening. This man teaches, lectures, and trains doctors all over the world, and tonight he's going to teach us about reversing the perfect storm of cancer. After teaching us for 20 minutes or so, he is going to open up the floor to ask some questions, and he always has all the answers. So please do not hesitate to put your questions in the chat so we can get to you. So without further ado, the floor is yours, Dr. Bob.
Well, thank you always, Carol. Thank you for always doing a great job setting up, getting everybody in, monitoring the questions. You're a gift to our universe. So thank you, thank you, thank you. This idea of the perfect storm of cancer was presented at a cancer lecture I attended over 30 years ago. I walked into a room of 200 doctors. A very prestigious PhD researcher named Dean Black was getting ready to give a cancer talk. And he asked a very strange question to the audience. And his first question was, how does a hurricane start? Well, fascinatingly, people had all kinds of different answers. And finally, Dean Black said, well, here's my answer to how a hurricane starts. A hurricane starts when conditions are just right. Well, then he asked the audience, how does a tornado start? And they started to catch on. Well, a tornado starts when conditions are just right. He then asked, how does cancer start? Cancer starts when conditions are just right. His next question was, how does cancer go away? Well, you change those conditions. So we live in a very interesting regulatory environment, and the FDA likes us now to give disclaimers really on anything. So I'm going to cite the medical literature, which I've done now for nearly 30 years, all the way across the globe. But the FDA wants people to know that statements have not been evaluated by the Food and Drug Administration, and any type of product is not intended to diagnose, treat, or cure, or prevent any disease. And by the FDA rules, only a drug can do that. Little background on me. Carol mentioned that I have lectured all over the world. And in fact, this was a picture when I was lecturing on nutrition and cancer. That was a conference with over 520 doctors in attendance. I've also treated patients from both ends of the spectrum. So these are world champions from every major professional sport, or at least I've treated from every major professional sport. And I've seen the other end of the spectrum. And this foot was literally sentenced to die. This woman was scheduled to have this foot with gangrene amputated right about there, 2 days from the first day I saw her. But notice the foot 2 weeks later, and then ultimately 17 months later, she never had a surgery. And the reason I show the picture of Dr. Dale Bredesen there is about 7 years ago, he and I were both lecturing at the same conference. And he was presenting his Alzheimer's research, which preceded his book, The End of Alzheimer's. Notice he says this is the first program to prevent and reverse cognitive decline. So what he taught is whenever there's a brain problem, a memory problem, there are three distinct zones of cells. There's cells that are dead. Well, there's nothing we can do about that. There's cells that are fine. There's nothing we need to do about that. But in between are cells that are functional but not functioning. And if we can bring back function, guess what? We can get function back. So this foot, I definitely see cells that were dead. Couldn't do anything about that. Those ultimately fell off. She never had a surgery. I don't see any cells that look fine in this picture, but apparently all those others were functional but not functioning. And look at how much healthier that foot is. And if I were teaching doctors, I would ask, by the way, how many cells of the body does diabetes affect? And the answer is all of them. So is it likely that just her foot got better? And the answer is no, her whole body got healthier. There's my beautiful family. So my wife of 33 years, 3 wonderful children and their spouses and almost spouse, soon to be spouse, and then my 2 beautiful granddaughters. And by the way, the things that we are going to talk about are safe and effective in pregnancy and for especially new moms and new babies. So I called that lecture The $1 Trillion Mistake, Redirecting Our Misguided War on Cancer. So President Richard Nixon, fairly infamous, December 23, 1971, declared a war on cancer. And at that point in time, the stats were 1 in 6 people would die from cancer, 1 in 4 would be diagnosed. Now, fast forward, when you look at the 2018 data is when I pulled up that chart, but 1 in 4.44 will die from cancer. 1 in 2 men will be diagnosed in their lifetime, 1 in 3 women. So have we made progress? And the answer is no, we've actually gone backwards. So you already know the answer to that. A hurricane starts when conditions are just right. And the perfect storm of cancer includes low oxygen, low nutrients, high acid, chronic inflammation, and immune suppression, usually secondary to chronic distress. And by the way, this isn't opinion. I'm going to show you what the published medical literature has to say about that. One of the questions is cancer genetic or environmental? And you might be shocked at the recommendations or the statistics on that, but all the experts agree that cancer is at most 5 to 10% genetic. If you were to look at data from the Royal Society of Medicine going back 100 years ago, it turns out only 2% of 80-year-olds died from cancer. Only 6% died from cardiovascular disease. Well, why does that make up 2/3 of all deaths today? Well, we've created an environment that promotes cancer and promotes cardiovascular disease. Notice that diet's about 1/3 of cancer. Just cigarettes themselves are about another third of cancer. Notice that obesity is 10 to 20%. So there's a lot of environmental issues there. This is a study that I believe should have turned the cancer world on its head. So if cancer was a genetic problem, if you took the genetic material from a cancer cell, which is what they did, and swapped it with the genetic material of a normal cell, we would expect a cell that got the cancer genes to become cancerous. But that didn't happen. When they put a cancer nucleus into a normal or healthy cell body, they actually produced normal cells. When they put a normal nucleus into a cancer cell body, that created cancer cells. So there is the medical study there. You can screenshot that. If you type that right in, it'll take you right to that article. So basically, environment is the predominant factor of cancer. So when we look up cancer and anaerobic, what does anaerobic mean? It means basically no oxygen. There are 2,658 studies on cancer thriving in a no oxygen environment. And look how far that goes back, 1937. So we're talking over 80 years. We've known that low oxygen is part of that. So what's one of our solutions to oxygen? Well, nitric oxide is a molecule that won an award called Molecule of the Year, but the team that discovered it also won a Nobel Prize. And very, very simply, a single molecule of nitric oxide can dilate blood vessels as much as 62%, or a single dose of nitric oxide. And here's our first medical reference. You can go to PubMed ID 295-72207, and you'll see that Ganoderma is a very powerful regulator of nitric oxide. And by the way, how many cells of our body require oxygen? Basically all of them. So we want to be able to effectively deliver oxygen. The Warburg effect basically talks about how these cells burn sugar in the absence of oxygen, and that actually creates a lot of acid. And that's why I use the term Warburg effect. And basically what we know is there are over 2,800 studies on that, again, going back nearly 70 years. By the way, when it says the common feature of this altered metabolism is the increased glucose uptake, cancer eats almost exclusively glucose. When I say almost exclusively, it's more like 99.99. So there's some evidence that 0.01% might be something else, but 99.99. And notice it says fermentation of glucose to lactate. If you look up lactate, that's another term for lactic acid, a very powerful acid in the body. So there's not anywhere near as much data on the alkaline diet as far as I'd like to see, but here's one article that talks about the medically proven benefits of an alkaline diet. And notice what it says. It reduces tumor cell invasion and metastasis, along with a number of other things. And let's go back to a second. If a tumor does not invade local tissue, if it does not metastasize, guess what? Unless it's growing in some place like in your brain that's in a life critical area, then it's not going to kill you. Picture the common cancers like breast or prostate or lung or liver. If it doesn't invade, if it doesn't metastasize, you ultimately find it and then you remove it and it's gone. So Ganoderma lucidum, the king of herbs, there's only one king, is widely held to be the most alkaline food in the world. So here's what I tell people. There are over 50,000 edible plants. I don't think they've tested anywhere near all 50,000, but of the ones they have tested, Ganoderma is the most alkaline. So here's another interesting fact. Coffee has more than 30 different acids. That's from coffeeresearch.org. And we actually deliver Ganoderma lucidum in coffee and tea, but we have a patented process by which we minimize coffee's acid. Now, that's very, very important for a lot of reasons. When people have a negative response to coffee, some of that is related to the acid, especially the gut distress. But by minimizing the acid in coffee, we maximize the enzyme activity of Ganoderma, and that maximizes its benefit in our bodies. So sometimes people say, well, I'll just put Ganoderma in my own coffee. It's not going to be the same thing. The total package, our deal, is the deal that has the best patented delivery system. When we look at cancer in the immune system, 218,000 results going back to 1908. And we know that our immune system should be on guard against cancer at all times. And it's estimated that nearly everybody walking around gets multiple cancer cells every single day. By the way, I tell people the enemies of the immune system are stress and sugar. I could go into a longer lecture and show that Ganoderma buffers stress by multiple mechanisms and is good for sugar regulation by at least half a dozen different mechanisms. But this is the tangent we'll take here. When we look at nutrition in the immune system, nearly 28,000 medical studies on PubMed.gov, and the Global Nutrition Report says every country on planet Earth suffers from malnutrition. So very, very fortunately, there are fewer and fewer starving children, but we do have an increasingly starved population. It's simple math. People found out that they could grow big plants with 3 elements: nitrogen, phosphorus, and potassium. It takes 30 elements to make healthy plants, animals, and humans. So if you take 30 out for every 3 you put back in, eventually you're going to create a problem. And the world governments are recognizing that we have created global malnutrition. So another reference, notice that micronutrient deficiencies and protein deficiencies comprise both the innate and adaptive immune functions, and it also leads to dysregulated inflammatory process and a dysregulated immune system. So now we go to Ganoderma, also known as reishi. This website, superfoodevolution.com, rates it as the top superfood on the planet. By the way, it is the consensus top superfood. It's got all the fabulous 50, all the vitamins, minerals, amino acids, proteins, carbohydrates, fat, fiber, and water, and in a dose that make a significant difference to human health. And it also has over 430 unique molecules that give it superpowers that are unmatched in the plant kingdom. And thus we have over 1,900 medical studies. But while we're talking about the immune system, this is from MIT, Massachusetts Institute of Technology. And here's what they say. This molecule, a bioactive proteoglycan fraction from Ganoderma lucidum, displays anti-tumor activity by increasing both antibody type immunity and cell immunity response. So here are cells attacking a cancer cell, but there are also cancer antibodies. And therefore, Ganoderma picks up both parts of the immune system that are known to be active against cancer. When you look at inflammation in cancer, over 410,000 medical studies on inflammation in cancer, and Ganoderma modulates the inflammatory process, by more than 13 known mechanisms, and more mechanisms seem to be discovered every single year. Then finally, we look at Ganoderma lucidum in cancer, 458 studies going back now over 33 years. So very, very powerful there. Here's one study, and you can look up this PubMed if you want, 296-91994. After more than 40 years of clinical use, its efficacy, safety, and long-term tolerability have been recognized. In addition, it reduces adverse reactions and improves the quality of life for cancer patients during chemotherapy. So efficacy, it's effective. That is proven over 40 years. Safety, that has been proven over 40 years. And long-term tolerability, you don't take it for a dose and get a 10-day break like you do with a lot of chemotherapies. You can keep taking it day after day, week after week, month after month, year after year. And I'm coming up on 9 straight years with, half a dozen doses a day. Now, do I remember all my supplements? No, but I never forget my coffee. And I love coffee. So I'm about 6 cups a day. Now my coffee loves me too. So look at this reference here. Basically, the title says that Ganoderma lucidum abolishes chemo resistance. We're going to come back to that again later. But if you have chemo resistance, it can be reversed. A lot of people know about antibiotic resistance. It means that the antibiotic no longer works against the cancer or against the infection. Chemo resistance means the chemo no longer works against the cancer. Now, that's a real big problem because the cancer gets stronger, the patient gets weaker, and the outcome probability always gets worse in that circumstance. Specific study here, Ganoderma enhances the radiation's killing effect on liver cancer. Now, there's plenty of data that it does it for other cancers as well. Someone had a question about liver cancer, so I addressed that. And then 2 people had questions about small cell lung cancer, which, by the way, has a very poor medical prognosis. So I copied the article. The PubMed is right there, basically. It's PubMed 191-88016. Notice it says multi-drug resistance is a major problem in small cell lung cancer. That's what they call SCLC. Then they talk about Ganoderma lucidum. And here's what it says. The results show that extracts of several species of Ganoderma are cytotoxic to both drug resistance and drug sensitive and drug resistant small cell lung cell cancer. So I'm going to go to here because it's a little bigger. And I'm going to tell what these words mean. Cytotoxic means it basically is toxic to the cancer cells. It can kill the cancer cells, whether they are sensitive to chemotherapy or resistant to chemotherapy. Now, some fancy language, it says it's pro-apoptotic. What does it mean? It causes the cancer cells to commit suicide, and then it induces gene expression patterns that are similar to small cell lung cancer cells treated with chemotherapeutic drugs. Well, what's the goal of the chemotherapy? You either stop the cell from growing or reproducing. If it can't grow, if it can't reproduce, guess what? Then it's not a problem anymore. Ganoderma does that. And then notice here it says can reverse resistance to chemotherapeutic drugs. There it is highlighted right there. 2 different people today, pretty fascinating, asked about small cell lung cell cancer. And then I had a question about breast cancer. 68 studies on Ganoderma and breast cancer. So what I want to do now is just for a moment, do a different screen share. So I'm going to share a new screen and I'm going to go to pubmed.gov. So here we are, and I typed in Ganoderma lucidum and breast cancer, 68 studies. So here, Ganoderma lucidum spore oil induces apoptosis. That's suicide of breast cancer cells. Beta-glucans, these are immune stimulating products from Ganoderma lucidum. Basically, that's a very good study too. And I'm not going to open that one up. Sometimes the studies just lead to it. Ganoderma lucidum suppresses proliferation and migration of breast cancer cells, and it tells how it does it. Anti-cancer and anti-inflammatory properties of Ganoderma lucidum on triple negative breast cancer. Anti-breast cancer enhancement from Ganoderma lucidum spores. Ganoderma lucidum reduces motility of breast cancer cells. Mushroom extracts and suppressive actions on breast cancer. Preventive and therapeutic effect of Ganoderma on skin disease. That one actually mentions breast cancer within it. Title's not very telling. A rational approach to cancer. Ganoderma lucidum impairs breast cancer, stem cells, etc. So 68 of those studies. So there's literally no way that anybody, in my mind, that is willing to do 5 minutes of research can't see very, very clearly that Ganoderma is very, very proven against many different types of cancer. So now we'll go back to this presentation again. So Now, Ganoderma and immune function, it's proven against breast cancer, prostate cancer, inflammatory breast cancer, leukemia, lymphoma, multiple myeloma, cervical cancer, melanoma, lung cancer, pancreatic cancer, colorectal cancer, liver cancer, glioblastoma, which is the most aggressive brain cancer, endometrial cancer, gastric cancer, bladder cancer, small cell lung cancer. It's also an autoimmune modulator, an allergy modulator. It has compounds that block replication of the HIV virus, herpes, H1N1, HPV, and kill some of the worst bacteria on the planet. So when you start looking at that, I have to wonder, why would anybody not take this on a regular basis? So Dr. Jen Simons is a medical oncologist, integrative oncologist. When she heard me lecture on nutrition and cancer, she said, look, my patients need to know this. Would you do a Zoom? I said, absolutely. Dr. Irana Ravilov, same thing. She said, will you do a Zoom? I said, of course, I'd be happy to do that. And then I love this story. So there's Pete Cohen, great friend out of London. He's not looking too good there, very somber. Why? Because that's his wife, who just got out of 9-hour surgery. She had a massive convulsive seizure, appeared to come out of nowhere. 9-hour surgery. They said, we're sorry, your brain is infiltrated with aggressive cancer. We don't have much to offer. Get your affairs in order. So anyways, Hannah came to see me as a patient. I did the nutrition of their program. Stanislaw Brzezinski did immunotherapies. By the way, Ganoderma is phenomenal. That's the claim you can take to the bank. It's known as an immune enhancer, regardless of the immune status. So it doesn't matter if you have allergy, autoimmunity, infection with any type of infectious agent, yeast, virus, bacteria, fungus, and it's anti-cancer. We saw that in many, many studies. So I told Hannah, look, you're fighting for your life. You have two choices, healthy coffee or no coffee. She said, well, I'm not doing without my coffee. I said, great, then it's healthy coffee. I wrote the foreword to her book. You can see she's already looking better there. And there she is in a very recent photo, 7 years cancer-free. So can you beat the unbeatable? Well, if you're willing to look outside the box, absolutely. If medicine's not giving you a favorable prognosis, or even if they are, if something like this is known to work with medicine, why wouldn't you do it? And before we go to questions and answers, these statements have not been evaluated by the Food and Drug Administration. These products are not intended to diagnose, treat, cure, or prevent any disease, but the medical literature is absolutely full of data. And we just covered cancer today. We cover some amazing topic every week. But my beautiful friend Carol, any questions in the chat?
As always, our friends are ready for us. So Karen would like to know, does Ganoderma thin the blood? She has a customer that has quit drinking coffee because she would get nosebleeds. Is it possible that this could cause blood thinning?
Well, I guess you could say that anything's possible, but I literally did a Zoom, or a little Zoom just on that. And so what the literature says about Ganoderma is that it basically prevents abnormal clotting without promoting abnormal bleeding. And as soon as I figure out how to copy that, Carol, I'm going to message it to you.
Yep. I'll put it at the bottom of the chat when we're done.
The chat.
Yeah. Okay. I'll get going for the next question while you find that.
Just found it. Just pasted it. Next.
Perfect. Okay. What products do you recommend for migraines with severe nauseousness?
Well, we always want to know what's causing the problem. And I could even pull up the study, but it basically says that Ganoderma lucidum is proven to eradicate migraine without side effects in the majority of the patients. So I will literally pull up that study and put it in there. But basically spores, but recall that any program is only as good as the compliance. And so if people, have problems taking capsules, well, then they may just want to do a coffee or tea. And what I'm going to do now is just quickly share the screen again. And I will do this view. So this is the International Journal of Pharmacy. And basically, Ganoderma lucidum, also known as reishi, is now being used in Pakistan. It is proved to completely eradicate migraine without side effects. That's published in the International Journal of Pharmacy. So spores are my favorite. I like 2 every waking hour. Then we have to suddenly, put a little disclaimer on there. The symptoms of chronic poisoning include fatigue, sleep disturbance, intestinal distress, allergy symptoms, headaches, confusion, and anxiety. And if someone's having a significant detox reaction, they could have any one or any combination of those symptoms. So we want to be careful.
Sylvia has a friend who just found out she has angular glaucoma in the eyes. Can Ganoderma help, and which capsules would be best for that? And perhaps what dosage?
I haven't read that study yet. I don't know if it will help, but it sure won't hurt. And so, again, we have no known toxic dose. They did animal studies where they infused 4,000 doses a day in a 100-pound dog. I tend to like 2 spores every waking hour, anywhere from 10 to 21 days. By the way, I've seen plenty of people with glaucoma where we actually do cranial manipulation. We work on the skull and we're able to change the eyeball pressure. And so there can be a mechanical issue there. And then medicine has a different way. They have ways that the eye, ears, and nose and throat are all connected. They can put little stents in happen to eliminate pressure as well.
Oh, okay. Kathy asks, have you ever helped anyone who has experienced chemotherapy resistance? And if so, how widespread was the cancer cells and what was the result?
Well, we certainly don't want to make any claims about anything. I've got plenty of videos on my Facebook page where people were going down in the wrong direction. We started a good program to unwind their perfect storm. And I have people that were sent home to die 25 years ago that are alive and well today. If chemo's failing, are they chemo resistant or what's happening? We don't really know. That's a pretty tough thing to say. There's plenty of people where they say the chemo doesn't work anymore. Suddenly we get them healthier and guess what? The chemo suddenly starts working. So we've seen that more than enough times. I always say, if you've got a pulse, you've got a prayer. The doctors are going to do what they know, and they know chemo very well. But sadly, even with all this data in the medical literature, you would have a hard time finding a doctor to have a conversation with that's read any of these studies. But as we share them, I think we'll get more and more.
Okay. Roseanne says she loves the coffee. It's her daily treat, but should she supplement with more Ganoderma lucidum?
Maybe. Depends on your goal, right? Bodies respond to frequency, duration, intensity, quality, and timing of stimuli. There's other things to do besides Ganoderma. I created my own nutrition pyramid, and the base of the pyramid is food. You've got to make good food choices. Then there's superfood. You've made a great superfood choice in Ganoderma. Then we can use medical foods or functional foods. And these are things that are actually regulated by the FDA with a proven health benefit, with guaranteed potency, guaranteed purity, proven effectiveness in human clinical trial, and every nutrient recognized as safe. Then we go with a good multivitamin, multi-mineral, activated omega-3s, a combination of D3, K2, and probiotics. And that makes up a comprehensive nutrition program. We're a malnourished world. The better we nourish ourselves, the better we can thrive in, even sometimes pretty extreme circumstances.
Okay. Scott asks, routinely ingesting 5,000 milligrams of vitamin C and 5,000 IU of vitamin D3, does this create too much acid in a healthy body? Am I creating an environment that fosters the growth of cancer cells?
Well, highly improbable. And so, ascorbic acid is a very weak acid. 5,000 milligrams is not much at all. Linus Pauling took about 18 grams a day, and he was still writing scientific papers at 95, and I think he died at 98. And he said, look, that's the thing I want, because he wrote a book on vitamin C 40 years ago, because only 4 mammals have lost the ability to synthesize vitamin C, and humans are one of those mammals. But a 150-pound goat in times of stress will make 15 grams of vitamin C a day. So there's plenty of alternative medicine practitioners that'll infuse 100 grams of vitamin C at a time, in times where people are having immune crisis with no known challenges. So 5,000 is a pretty good dose. And, you know, did he say it's D3, the one that he's taking? I mean, that's awesome. The world is vitamin D3 deficient.
Yes. Okay. Jennifer's just commenting for vitamin D3. Is Ganoderma lucidum FDA approved in the US?
That's a pretty interesting question. I actually don't think it is because it's a superfood, you know? And so is our oranges approved? Are apple approved? Is seaweed approved? Is algae approved? Is honey approved? No, the FDA doesn't do anything with that. Now they do approve drugs. That's what they allow health claims on. And I find that absolutely fascinating. I was at a lecture probably 30 years ago, and the doctor said, what if we took a healthy person and we started giving them drugs? What would happen? And the whole class responded, well, they would get sick. And they said, well, why do we give drugs to sick people and think they're going to get healthy? And the FDA, by the way, has a guideline on drugs. They say you should use the lowest dose for the shortest duration. Now, that's a problem with me being a math major because the lowest dose is 0, the shortest duration is 0. But we get what they mean, right? I mean, if you can do something with a small dose of one drug one time, do it. If you need a couple doses, do it. But don't be doing this forever unless there's something that just can't be resolved. And if we get the things early enough, we can resolve them, generally speaking.
Okay. All right. How does Ganoderma affect someone on dialysis? Does it lower or higher creatine levels? And can someone who has elevated creatine on dialysis take, Ganoderma?
Well, we've seen plenty of people on dialysis have phenomenal benefit with Ganoderma. Interestingly enough, I was giving a lecture of all places in Wales on Ganoderma, and the guy was talking about how he switched to Ganoderma coffee and he could feel his feet again. Because, there's a lot of things that go wrong by the time someone gets on dialysis. They're usually going blind. They have peripheral neuropathy. They may have amputations. It's not a good place to be, but he started drinking Ganoderma coffee and he could start feeling his feet again. So many of the complications of diabetes, including diabetic kidney, are proven in the medical literature to be helped by Ganoderma. So, it goes back to, we have 3 distinct zones of cells. We have cells that are dead. We can't do anything about that. We have cells that are fine. There's nothing we need to do. In between our cells that are functional but not functioning. And this is a solid strategy to improve function. There may be other strategies as well.
Okay. Just letting everybody know, I did copy your information into the chat for everybody. It is in there, the link, so they can get to that information you posted.
Perfect.
Can Ganoderma improve memory loss?
Well, they actually have medical studies on Ganoderma increasing brain stem cells, dissolving the amyloid plaque of Alzheimer's, improving acetylcholine. Dr. Dale Bredesen has identified something like 36 risk factors for Alzheimer's that can fall into 3 major categories. And one of those categories is toxicity. Ganoderma can pull the toxins out. Another is loss of nerve growth factors. Ganoderma enhances that. And the third is just basically insulin resistance causing inflammatory process, and Ganoderma is good for that as well. So there's plenty of studies. You can go to PubMed, type in Ganoderma and Alzheimer's, and you'll see that it can prevent, or as Dr. Bredesen said, in many cases reverse. And we've had people that have had full-blown dementia that when they switched their tea over to ours, within a matter of months, they got their memory back.
It's so awesome.
It is.
That is the end of the questions thus far. Is anybody going to throw any more in the chat? Oh, here we come.
I can't trust anybody.
What would you recommend for helping heal wisdom teeth extractions?
Well, we're on the topic of Ganoderma, but there's so many things that you can do. A comprehensive program is what I always recommend. So that's going to be a good diet, right? If God made it, it's okay. If man made it, stay away. Ganoderma as much as you want to take. Multivitamin, multi-mineral, omega-3s, probiotics, D3, K2. But then there's also some bone meal. I use a bone builder from New Zealand cattle, and there's actually a bony injury when they do a wisdom tooth extraction. So why not do a little bit of that there as well?
Perfect. What about cerebral palsy?
Well, that's a hypoxic brain injury. And so under low oxygen, the brain is damaged. So I was at a conference in Sao Paulo, Brazil, and there was an American researcher that was showing phenomenal cerebral palsy data with hyperbaric oxygen. So when they were able to increase oxygen delivery to the brain, they were able to accelerate, improvement in function. It all comes back to there's three distinct zones of nerve cells. There's nerve cells that are dead. We can't do anything about that. There's nerve cells that are fine. We don't need to do anything about that. For those that are functional but not functioning, we can get function back. But we know that our brain changes itself, and with the right type of therapy, the brain can rewire. And there's people that have very significant brain injuries that can get back a lot of function just by rewiring their brain. That's good physical therapy and good brain therapy to do it.
Okay, any recommendations for low white blood cell count?
Well, Ganoderma stimulates the immune system. We have to figure out what's causing the problem. A chronic virus can often have an impact on low white cell count. There can be a bone marrow problem, and that is often related to heavy metal toxicity. So there's things that can clear heavy metals. The body can make metallothionein proteins. I use a supplement from a company that's shown to increase metallothionein proteins by 40x in just 2 weeks' time. Other things can chelate. Vitamin C is a bit of a chelator. Cilantro is a chelator. Parsley is a chelator. There's medical chelators like EDTA, DMSA, DMPS. So there's lots of things that can be done, but ultimately we want to figure out what's causing the problem. Then we can make the best recommendation. And Ganoderma is great for the immune system.
Okay. What do you recommend for dental inflammation?
Well, one, we want to have really good oral hygiene. We want to make sure we're not having acid reflux. And again, Ganoderma is anti-inflammatory by at least 13 proven mechanisms. So that's a good start. But, a good dentist ought to be able to tell you what's causing that problem and hopefully fix it.
Okay. Angela asked Dr. Bob, what do you recommend for uterine fibroids, cysts, and fatty deposits?
So we did a whole talk on women's health, and we know that fibroids are basically an immune failure, often related to estrogen toxicity. And Ganoderma is good at reducing the estrogen toxicity. It's great at enhancing the immune system as well. And cysts and fatty deposits, well, the body's irritated about something, and something is dysregulated. Fatty deposits, I don't know if they're talking about lipomas. Those are unique, and those usually need to be injected with enzymes or removed. There's people that have those. It's a bit of a genetic issue. This can be anywhere, an ovarian cyst that has to do with insulin resistance, obesity, estrogen toxicity. So we need a little more specificity there.
Okay. I'm going to try not to butcher this, Karen. If a child is taking cyproheptadine, could he switch to spores instead?
I don't even know what cyproheptadine is. So I'm going to go to Google here, and I'm going to type in cyproheptadine. Looks like it's an appetite stimulant. I'm going to look at mechanism of action. It's an antihistamine. So one, we can't give advice on any medication that any doctor is recommending, but if it's an antihistamine, Ganoderma is antihistamine. Okay. So it has antihistamine action.
Dr. Jennifer asks, will a spore speed up broken bone or operated bone healing?
So I had a 75-year-old woman a few months ago that seriously broke her upper arm. And it was a displaced fracture. And I gave her a combination of spores every waking hour and bone builder. I gave her three tablets 5 times a day. And at 3 weeks, the orthopedist was beyond amazed. He said the fracture had completely healed. She was then taken out of immobilization. We're talking about a 75-year-old female. And he said, my gosh, that fracture is healed so well, I could drive a truck over it and the bone would not break in that spot again. So every case is individual, but we know we can accelerate healing when we provide the right things. I see someone directly message, can you refer me to our bladder cancer support group? Absolutely. Anything else? Okay.
Nope, that comes to the end of the questions, the second round.
All right. So, sometimes people feel like we leave them hanging. And so I'm not going to leave you hanging. I'm going to mention a few more about how maybe you can get some Ganoderma lucidum if you want, right? So first question is just looking at what we talked about: increasing oxygen, increasing nutrients, decreasing acid, modulating the inflammatory process, enhancing the immune system, eradicating migraines, the other things that we talked about. Do you know anybody who could benefit? No known toxicity, no known drug interaction. How about everybody we know? So why did we put it in coffee and tea? People forget a lot of things, but they never forget their coffee or tea. The world consumes 2.25 billion cups of coffee every single day. If you try to get an idea of how big that number is, 2.25 billion seconds ago was over 71 years ago. So, I mean, that's a mega number. And just imagine if every sip of coffee made their body better. This is proven safe in pregnancy. And by the way, I say every pregnant woman should take this. No known drug interaction, no known toxicity. My daughter and my daughter-in-law both consumed it multiple times, very smooth, multiple times every day, very smooth pregnancies, very wonderful babies. Then when you look at the reasons why people take anything, it's got to be delicious. Our coffee, tea, shakes, hot chocolate, all qualify for that. Has to be affordable. We're cheaper than Starbucks. Our shakes are phenomenally cost effective. Everything's just add water, and ours is turbocharged with a patented competitive advantage. And then when we start talking about coffee, years ago, I tried to get people to quit coffee when they do a detox. Forget it. They weren't going to do it. I could take away their gluten. I could take away their dairy. I could take away their sugar. I could take away their alcohol. Try to take away their coffee. We have a fight. So now I just say healthy coffee or no coffee. Einstein talked about how compounding is the eighth wonder of the world. Well, if the average person in North America drinks 3.3 cups a day, and they do that 365 days a year, that's 1,200 cups, each one of them moving that body towards a better state of health. Can you think of a better way to compound wellness than putting it in something that people do every single day? And then our business model compounds. If you could imagine yourself finding 10 people that feel overworked, underpaid, looking for opportunity and wanting to partner with a group like us, well, then you're on your way, right? And by the way, it doesn't have to be 10. You can start with one, but then when those 10 get 10, you're at 100, and then you get to 1,000, then you get to 10,000. What if you could positively impact the lives of 10,000 people every single day? Well, there's something called the law of compensation. It says you will be compensated according to how many people you help and how much you help them. What if you help 10,000 or more people enjoy their life better every single day? I know you would be wonderfully compensated. And when you think about our world right now, do you know anybody that's more interested in health maybe than there ever were, more interested in wealth than they were, or maybe even both? And both of those things are here. I always like this question. We only talked about coffee and tea and shakes and hot chocolate, but what if someone asked you, would you like to take your better brain, body, and beautiful skin to wonderful places and enjoy deliciousness? And then how about ultimately with whomever you want, whenever you want? And that's what this offers. Go look down the road 5, 6, 7, 8, 9, 10 years, and you're helping 10,000 people a day. If you were responsible for building that team, I promise you will be wonderfully rewarded. You get a world-class website, a merchant account, customer service, shipping, mentorship, access to things like this. And it's not $49.95. The company has a special now for 2021 is $20.21. So now you can join a team like this with products like this, with research like this, with the highest quality Ganoderma in the world and the best delivery system for $20.21. So your call to action is pretty simple. Whoever referred you to this Zoom or the replay, get back that to them right away, and you can join for 2021. Then you're going to want some inventory, coffee and tea and hot chocolate and shakes. Maybe you want to look at our brain line. So we've got a partnership with a brain technology called NeuroTracker. 53 published studies over 20 years. Their catchphrase is a better brain in 90 minutes. But how about with Ganoderma as a synergist, a much better brain, 130% better brain with Ganoderma in 90 minutes over people that didn't take it. Skincare so clean that you could actually eat it. Partnerships with over 100,000 resort locations all over the world where you get the dream vacation at the guaranteed lowest price. And then if you're business minded like me, there's accelerator packs. We call them good, better, best, or bronze, silver, or gold. When I decided to build this business, I said, you know what? I'm not leaving any money on the table. I'm going to go with the gold pack. And that, by the way, that's what I recommend if you are serious about building the business. I always like the myth of Sisyphus. He was being punished by the gods and given a task that he couldn't win at. But what if we could change the game? What if we could join a team that helped us from above or build a team that helped us from below? And that's what we get to do in this business model. One of my great mentors, Jim Rohn, he was a college dropout in the 1960s. He became a multimillionaire in this business model. And by the way, it's been around now for over 70 years and has created countless millionaires. But Jim Rohn would finish his meetings with 4 questions. And here they are. Why? Why did you tune in with us tonight? There's so many other things you could do. The second question is the answer to the first. Why not? Why not learn about something with over 1,900 medical studies, 450 studies on cancer, and expanding every single week? Well, why not? Why not learn about something that is so powerful, right? Why not you? Someone's going to say, this makes sense. I'm going to start putting this in my body, and I want to partner with this team and start building. And here's the final question. Why not now? The longer you wait to act on information, the least likely you are to act on it. So I'm going to encourage you to go back to whoever referred you to this Zoom or replay and say, this makes sense. By the way, the 2021 special ends at the end of January. So January 31. So get in, get started. And next week, you can invite people to the next Ask the Doctor. And by the way, we have an opportunity presentation tomorrow at the same time. Carol, any words of wisdom to wrap up?
Well, I will be here with you tomorrow night when we present the opportunity with everybody. And I'm sure DJ Josh is usually in the house with us, which is awesome. But I just want to thank you for once again giving us all of this wonderful information. And I'm pretty sure everybody else would like to unmute and say thank you as well.
Appreciate it, Dr. Bob.
Thank you,
Thank you,
Dr.
Dr.
Bob.
Bob.
Thank you.